If you are a woman in your mid-30s, 40s, or early 50s, and something just feels off, your sleep is not what it used to be, your mood shifts without warning, or you cannot remember why you walked into a room, I want you to know you are not imagining it. Your body may be going through one of the most significant hormonal transitions of your life. Today, we are talking about perimenopause, what it actually is, when it starts, what symptoms to watch for, and most importantly, what you can do about it. Because this is a phase of life that for too long has been dismissed, minimized, and misunderstood, and you deserve real answers. I am a physician, and I see women every week who have been suffering for years without anyone connecting the dots for them. That ends. What is perimenopause really? Let's start with the basics because there is a lot of confusion around this word. Perimenopause literally means around menopause. It is the transition period your body goes through before you reach menopause, which is officially defined as 12 consecutive months without a menstrual period. Here is what surprises most women. Perimenopause can begin as early as age 35, not 45, not 50, 35. For most women, it starts somewhere between 38 and 45, but the range is wide, and it can last anywhere from 2 years to 10 years. So when a woman in her late 30s comes to me exhausted, anxious, and not sleeping, and her doctor told her everything looks fine, perimenopause is often exactly what is happening. The reason symptoms start so early is that your ovaries do not just suddenly stop working one day. It is a gradual process. Estrogen and progesterone levels begin fluctuating, sometimes surging higher than normal, sometimes crashing lower. It is this unpredictability, this hormonal instability that drives most of the symptoms women experience. Think of it less like a switch being turned off and more like a dimmer that someone is slowly adjusting, but not smoothly. It flickers, and your body feels every flicker. The most common symptoms. Now let's talk about what perimenopause actually feels like, because the symptom list is much longer than most people realize. Brain fog is one of the most reported and most distressing symptoms. Women describe it as feeling mentally slower, struggling to find words, forgetting things they would never have forgotten before, difficulty concentrating at work. This is not you getting older. This is estrogen, which directly supports brain function, becoming unpredictable. Your brain is literally running on an inconsistent fuel supply. Sleep disturbances are another major one. You may find it hard to fall asleep, or you wake up at 2 or 3 in the morning and cannot get back to sleep. Night sweats can also wake you repeatedly. Poor sleep then amplifies every other symptom. The fatigue, the mood changes, the brain fog. It becomes a cycle. Mood changes and irritability are extremely common and extremely misunderstood. Women are often told they are stressed or anxious or depressed. And sometimes they are prescribed antidepressants, when the root cause is actually hormonal. Estrogen and progesterone both have direct effects on the brain chemicals that regulate mood. When those hormones fluctuate, your emotional regulation becomes harder. You may feel rage you cannot explain, anxiety that comes out of nowhere, crying without knowing why. This is not a character flaw. It is biology. Fatigue beyond what is normal is something I hear constantly. Not just tiredness, a deep, heavy exhaustion that sleep does not always fix. This is related to disrupted sleep, but also to the metabolic changes happening as hormones shift. Irregular periods are often the most recognized sign, but they do not always come first. Your cycle may become shorter, longer, heavier, lighter, or completely unpredictable. Some months you may skip entirely. Hot flashes and night sweats, the classic symptoms most people associate with menopause, can absolutely begin in perimenopause, sometimes years before your last period. Changes in libido are very common, but rarely discussed openly. Declining estrogen and testosterone affect sexual desire, and vaginal dryness can make intimacy uncomfortable. Joint pain, headaches, and heart palpitations. Yes, all of these can be perimenopausal symptoms. They are less talked about, but very real. The key takeaway here is that perimenopause is a whole body experience. It is not just about periods or hot flashes. It touches your brain, your sleep, your mood, your energy, your joints, and your heart. Why is it so often missed? This section is important because many of you watching have probably already been to a doctor and been told everything is fine. Standard lab tests, including the commonly ordered FSH test, are often not helpful in perimenopause. Hormone levels fluctuate so much day to day that a single blood draw can look completely normal even when you are deep in the transition. Your doctor checks the number, sees it is in range, and says you are fine. But the range they are comparing it to may not account for where your body individually needs to be. There is also a historical gap in medical education around women's hormonal health. Perimenopause was not taught in depth in many medical schools. Some doctors are not confident identifying it, so they attribute the symptoms to stress, depression, thyroid issues, or simply aging. This is why women spend years, sometimes a decade, going from doctor to doctor, being prescribed antidepressants, sleep medications, even anxiety medications, when the underlying driver is hormonal transition. If you feel that your symptoms are being dismissed, you have every right to advocate for yourself. Ask specifically about perimenopause. Ask for a hormone panel that includes estrogen, progesterone, FSH, LH, and testosterone. Find a physician who specializes in women's hormonal health if needed. You know your body. If something feels wrong, keep asking. Lifestyle changes that make a real difference. Now let's get into solutions because there is genuinely a lot you can do. Let's start with lifestyle because these changes are accessible to everyone and they work. Diet plays a significant role. A diet rich in vegetables, quality protein, healthy fats, and fiber supports hormonal balance and reduces inflammation. Reducing processed foods, sugar, and refined carbohydrates is particularly important. These spike blood sugar and worsen mood swings, fatigue, and brain fog. Phytoestrogen-rich foods like flaxseed, soy, and legumes may also help ease symptoms in some women. Exercise is one of the most powerful tools available. Regular physical activity, particularly a combination of strength training and moderate cardio, supports estrogen metabolism, improves sleep quality, lifts mood through endorphins, and protects against the bone density loss that accelerates in this phase. Even 30 minutes of brisk walking 5 days a week makes a measurable difference. Stress management is non-negotiable. Cortisol, your stress hormone, directly interferes with estrogen and progesterone balance. Chronic stress makes perimenopause significantly worse. Practices like meditation, deep breathing, yoga, or even simply protecting time in your day for rest are not luxuries. They are medicine. Sleep hygiene needs to become a priority. Keep a consistent sleep schedule, keep your bedroom cool, avoid screens for an hour before bed, and limit alcohol, which many women find dramatically worsens night sweats and sleep quality even in small amounts. Supplements that may help. Beyond lifestyle, certain supplements have evidence supporting their use in perimenopause. I always recommend speaking with your doctor before starting anything, but here are the ones worth knowing about. Magnesium glycinate is at the top of my list. It supports sleep, reduces anxiety, eases muscle tension, and helps with the headaches that women experience. Many women are deficient without knowing it. Vitamin D3 with K2 is important for bone health, mood, and immune function, all areas affected in perimenopause. Ashwagandha is an adaptogen that helps the body manage cortisol and has shown benefit for anxiety, sleep, and fatigue in several studies. Black cohosh has been used for decades for hot flashes and mood symptoms, with a reasonable body of research supporting its use. Omega-3 fatty acids support brain health, reduce inflammation, and may help with mood stability. Again, supplements are supportive tools, not replacements for medical care. Use them as part of a broader approach. Hormone replacement therapy, the conversation you need to have. I want to address hormone replacement therapy directly because there is enormous confusion and fear around this topic. For many years, HRT was avoided because of a large study in the early 2000s that suggested links to breast cancer and heart disease. What followed was a generation of women being denied effective treatment because of that fear. Since then, the research has been significantly re-examined. The current understanding, supported by major medical organizations, is that for most healthy women under 60 who are within 10 years of menopause onset, the benefits of HRT outweigh the risks. In fact, for bone health, cardiovascular health, brain health, and quality of life, HRT can be genuinely protective. There are different types: estrogen only, combined estrogen and progesterone, bioidentical hormones, patches, gels, oral forms. The right option depends on your individual history, your symptoms, and your risk factors. What I want you to take away from this is do not let outdated fear stop you from having this conversation with your doctor. If your quality of life is being significantly affected by perimenopausal symptoms, HRT is a legitimate, evidence-based option worth exploring. You deserve to have that discussion with full, accurate information. Perimenopause is not the end of anything. It is a transition. And like every transition, understanding what is happening is the first step to navigating it well. You do not have to white-knuckle your way through the next decade. You do not have to accept brain fog and exhaustion and mood swings as your new normal. There are real evidence-based tools, lifestyle changes, supplements, and medical options that can genuinely improve how you feel. If this video helped you, please share it with a woman in your life who needs to hear it. And if you have questions or symptoms you want me to address in a future video, leave them in the comments below. I will see you in the next one.